My shoulder surgery practice is quite broad. In the contact and collision athlete population in particular, we see a lot of shoulder instability or dislocations, and so we'll do arthroscopic repairs, labral repairs, what we call typically a Bankart repair. In some cases we get complicated injury patterns, especially with the higher level athletes, like 180 degree or 360 degree labral tears, and have had a good experience with repairing those. In some cases, particularly if there's bone loss or revision surgery, procedure called a Latarjet by the French surgeon who described it has become a particular interest of mine, and have some research underway looking at that. That's a procedure that has some a bit of a learning curve, but at this point seeing really nice results with Latarjet stabilizations. A very, very common condition that we see, particularly as people and athletes accumulate some birthdays, are rotator cuff tears. And I do a very, very high volume of rotator cuff surgery. And related to that, I'm really exploring ways to optimize outcomes and reinforce our repairs, including collagen patch scaffolds or dermal allografts. I am doing the superior capsule reconstruction procedure for irreparable rotator cuff tears, which is a great option for a very difficult problem. And then for more advanced arthritic cases, anatomic shoulder replacement and reverse shoulder replacement have become really a mainstay of shoulder surgery practice, and are a great option for people that have exhausted conservative treatments. In addition, in some cases, when a prior shoulder replacement has worn out or become unstable but needs to be revised, I'm also doing revision shoulder replacements when indicated. Really anything that's in the shoulder surgery spectrum, I'd be happy to see you for and help try to take care of you.